Hey guys, it's Lori. Thought I would jump on here really quick and do a little video. I've been kind of out of pocket. I'm actually out of state. I'm in Wisconsin right now, visiting a friend, and came across a really interesting article that I wanted to talk to you a little bit about. I posted it. It's called "The Treatment of Viral Diseases. Has the Truth Been Suppressed for Decades?" And also kind of discuss with you some ideas that I have for further educating parents and also even healthcare professionals about the dangers of prescription drugs, potentially what can go wrong, the dangers of vaccines, that kind of thing. Because I'm seeing so much intimidation of parents in particular on some of the groups I'm in by doctors, and it's really disconcerting to me, particularly as a pharmacist, because pharmacists are in a unique position in that we challenge doctors. When they write a prescription that's written wrong, or maybe out of the prescribing guidelines, or we question a dosage or a quantity or anything, we make that phone call, or at least I did, and say, hey, I'm questioning this and why. And so I have had the personal experience of being really talked down to by doctors and know how they can be so intimidating. The thing was, I had a license to protect, so it really doesn't matter how stupid you want to make me feel because I'm questioning you. And not all doctors were like this. I'm not sitting here saying all doctors were like this, but a lot of them are. And so when I read these stories by parents, it really, just the ire rises up in me, because I know what it feels like as a healthcare professional to be treated that way. I can't imagine being a parent who's just wanting to know what's best for their child, and yet they can't even get a straight answer. They're just talked to like they're stupid. They're talked down to. Hey, Rebecca, how are you? So anyway, hi, Andrea. It's great to see you guys. I've been out of pocket for about 2 weeks, and I'm going to be gone another week. So I'm visiting a good friend of mine who actually lives in Tulsa, but we're in Wisconsin right now at another house that she owns. So pretty fun getting to travel the country a little bit, kind of do something besides the mundane. But anyway, this article, "The Treatment of Viral Diseases, Has the Truth Been Suppressed for Decades?" is written by Dr. Lee D. Merritt, MD, who actually started medical school in 1976. But it was this pandemic that basically made him start looking at other treatments for viral diseases. And he came across and realized there were tons of articles out there on hydroxychloroquine, on chloroquine, on even azithromycin and use against viral pathogens. And yet these articles have been suppressed. And he goes on and he talks about, influenza, the fact that, I thought this was a brilliant statement, consider that the $69 billion per year vaccine industry is based on preventing viral diseases that are otherwise untreatable, like viral influenza A, measles. Sorry, I don't know why my internet just lost. I'm actually in the room with the internet. Let's see. If untreatable viruses like viral influenza A, measles, etc., if we found an effective treatment that wasn't a vaccine, the entire vaccine industry crashes down like a house of cards. And he talks about the CDC and the fact that they say 80,000 people in the U.S. died last year from the flu. But when you really start to do your research, you realize there was only about 6,000 people that had actual viral influenza. So here we are vaccinating the entire nation against influenza to prevent 6,000 deaths. Is hard to justify, but the bigger lie is even worse. Based on the currently available science, it is probable that the treatment with hydroxychloroquine or HCQ in patients with severe influenza or influenza-like illnesses could have saved millions of Americans from dying. So all this time, instead of pushing a vaccine for the flu, which we know doesn't work, we could have been treating these people and prevented God only knows how many deaths. He goes into vaccination, began with smallpox, then polio. He says, then vaccination programs expanded to childhood viral illnesses, including benign ones such as mumps. Influenza then became the big vaccine target. And he says, along the way, teaching the immunology of communicable diseases to medical and nursing students got distorted. Most physicians today don't learn that the mortality or the death from childhood diseases in well-nourished, unvaccinated first world children was negligible prior to the advent of vaccines. And this is what prompted me to create, and it's on my website, it's called Cheat Sheet for Parents. It's a PowerPoint slide. I go through, this is the one I've created so far is geared toward the vaccines we give under a year, so at birth, 2, 4, and 6 months, because I wanted parents to see how these diseases were transmitted and to see before we started vaccinating what an incredible low percent of children were even contracting, let alone dying, of the diseases that these doctors make parents feel like they're horrible parents, they're going to kill their children, whatever, if they don't get them vaccinated. And, he points out what they're trained in school. They're not trained on the statistics of the diseases. They're just trained to push the vaccines. So anyway, huge disconnect. He also talks about COVID-19 and the war against hydroxychloroquine. Brings in Anthony Fauci and asks the questions, why is he so strongly promoting, a $3,600 remdesivir that hasn't even finished any clinical trials? It's a new drug. It's being used experimentally, and almost totally ignoring $20 hydroxychloroquine, other than to say that the latter, the hydroxy, has an unproven benefit. It's a really good article. So he talks about political cover-up, and he gives a ton of references. So he also talks about all the money that Bill Gates and stuff has poured into the vaccines. So again, I already posted this. I can post a link when I post this video, but I highly suggest you read it and share it because it is excellently written, and it's just exposing the truth, which is a big deal. So I was consulting with a patient this week, and mind-blowing thing happened to her. She went in for a colonoscopy, okay? Just routine colonoscopy. 10 days later, ends up hospitalized with autoimmune hepatitis. Her liver enzymes had literally shot through the roof. And she literally tracked me down. I was driving to Tulsa, and I ended up doing a partial consult with her over the phone, driving, because she was so upset. She'd been discharged from the hospital. Of course, the doctors, all they have in their little black bag is either vaccines or drugs. And so what they had prescribed, which she had not picked up yet, didn't want to pick up, was immune suppressing, symptom suppressing drugs to treat her hepatitis. Well, it turns out as I began to talk to her and we began to have this conversation, and she'd actually done some research on her own based on what she'd been given in the hospital for the colonoscopy, it looked like the hepatitis was more than likely related to an very adverse reaction to that drug, which is they gave her, which is metabolized in the liver. Just another example of our healthcare system that's supposed to be preventing something, and this poor woman ends up in the hospital. She's terrified. The good news is she's really, really waking her up on eating differently, and she's radically changed her eating habits and working toward getting her body back in line. But the doctor, the specialist that she went to, denied that it was the drug that she was given at the colonoscopy as being a possible link to her autoimmune hepatitis. When never had she had readings like this, not even anywhere close. I mean, her enzymes literally went into the thousands, up from what normal is like below 40. Hers were, always ran a little on the higher side in the 60s, but still not in the thousands. So she has this horrible adverse reaction. This doctor turns around and denies it, So I don't know. This is telling me my iPhone storage is full. Who knew? So I guess I need to jump off of here. I guess I'm still recording, but need to delete a few things apparently. Anyway, it's just mind-blowing. And then I keep seeing these, pregnant women questioning vaccines. The doctors won't have that conversation. It's just, get your vaccination when they've never been tested in pregnant women. I was counseling with a mother who the doctor was pushing a tetanus shot on this child that only had a scraped knee. I mean, she didn't even go in there for the scraped knee. And they're pushing, and then, the parents are questioning, and they're getting all of this flack from this doctor instead of answering their questions legitimately, because the doctors really don't know. That's the truth. They don't know. And they don't take I don't know well, right? They want to just intimidate you and convince you they know everything, which is truly, truly sad. So what I was thinking about is maybe doing Zoom calls that are planned and scheduled to where I can educate parents and we can have an interaction, educate you on vaccines, educate you on how to talk to the doctors. I've also thought about doing it for healthcare professionals too, because the majority of healthcare professionals are clueless on vaccines. I also did a consult with a nurse 3 or 4 days ago who's just now waking up. And the general idea is to make a platform that's interactive to where not only can I educate you, but you can ask questions and get feedback so that you know where to go to research, know what you need to be looking at. Because when you just tell a parent you need to do your research, it's pretty hard for them to know where to even start with that. And that's what pharmacists do, basically. We are experts at answering questions. We are one-on-one with patients. We are the professional expert that is standing there ready to answer your question. And so I was just thinking that might be a good way, a good platform to further educate parents and do it maybe on a weekly basis so that you can invite friends or whatever so that they have a chance to ask the pharmacist, discuss it. I'm not trying to convince anybody of anything, but I want you to know where to go to do your research and what questions you should be asking. Oh yeah, Shonda, hey girl. Yeah, you texted me about that HPV thing. Oh my gosh. It's just mind-blowing. So anyway, I'm not home, but I'm going to work on writing the curriculum. It's not going to be anything really deep. I basically like the top 4 things you need to know to make an educated choice on vaccines. Something like that that's simple, that's straightforward. Hey, Mary, thanks for this article. That's what I'm sitting here talking about it. Mary is the one that sent me this article this morning on the treatment of viral diseases. So thank you for what you guys share with me. Keep sending anything you think, because I'm open to doing a video and educating, and because I just feel like there is such a disconnect with people knowing even what questions to ask. They don't know how to have a conversation with the doctor, and a way to do it in a non-confrontational way where you're just asking them questions, but it will literally show you that they do not know what they're talking about. Because they're going to sit there and try to intimidate you and not intelligently answer your questions, give you time to breathe. It's like, oh, no, you got to do it. Just like that used car salesman. You got to buy the car today. You got to vaccinate today, and that's just not the way to handle it. And this is all beginning really to blow up, thank God, because the truth is being exposed, and I'm so thankful for that. I need to give this to my daughter. She's being pushed to vaccinate her 3-month-old. She won't speak up. Yeah. See, and also helping you to find other doctors. I would be more than happy to help you find another doctor. Because if you have a doctor that's going to intimidate and not going to have an intelligent conversation with you, you need to hit the road, Jack, okay? You need to hit the road. That is absolutely unacceptable. And here's the thing, if the parents don't speak up, we're training doctors that that behavior is okay and it's the way to get results. And it's not, okay? That's extremely bad behavior of any healthcare professional, but especially a doctor with a parent who is just going, hey, I don't know about all this, and you're the expert, you need to tell me. But the reality is they're not the expert. All they've been given is a black bag that has drugs and vaccines in it, and if you start to question them outside of that reality, they lose it. I mean, this doctor that told the lady I counseled with that went in for the colonoscopy couldn't answer how this happened, because I'm having that conversation. Like, your liver doesn't just blow up out of nowhere. There's cause and effect, okay? Something tripped the trigger. Now, but this doctor's not interested in finding out what tripped the trigger. They were just upset because she didn't start the immunosuppressive drugs, which were, by the way, metabolized in the damaged liver. Thank you very much. How brilliant is that? You're going to put more of a toxic load on a liver that's already screaming, I'm having issues here. It's inflamed. Hepatitis is an inflammation, right? But that's all the doctor knew was, oh, you didn't start the drugs? Well, no, she's questioning the drugs. I mean, they actually ended up having a good conversation the way she handled him, which I was very proud of her. But just the fact that they didn't even want to ask the question, what could have caused this, so that we can prevent it from happening again. Oh no, here's your drugs. Pick them up. Pharmacy, Anyway, they will not take patients if they say they won't vaccinate. So you have to say that you are waiting, but will vaccinate. Right. Yeah. And I think that's an important conversation to have, how to negotiate that. Because that's a slippery slope. That's a really slippery slope. And I understand that parents are freaked out about not taking their kids to appointments and stuff like that. So that's all stuff that needs to be negotiated. And so that's why I kind of came up with the idea of doing Zoom calls and having sort of like a classroom setting where we can interact and they can ask me questions like that. But anyway. All right, guys, and then I had this nurse contact me who's waking up about vaccines, and she was asking in regard to her son who's been having some issues health-wise, and of course, he happens to be fully vaccinated, but she's realizing, some of the issues he's having are more than likely from the vaccines. So, anyway. All right, guys. Well, Lisa, why don't you shoot me a message through Messenger, or if you want to contact me through my website, it's Thewisepharmacist.com, and there's a contact sheet that you can fill out through there, and I'll have your email, and then we can email back and forth, because I do get a lot of things on Messenger, so I try to make sure I answer everything, but sometimes I just don't see it. So anyway. Hey, you're welcome, Raylene. Thank you for joining me. So anyway, I'm going to go ahead and jump off here, guys. And sometimes I wonder if I'm making the right choice. Yeah, exactly. And that's why it's important to know statistically where these diseases are, and what are the odds of your child dying or contracting even. It's just having somebody that's basically in your corner, reaffirming your decision and why you're making the decision, or answering the questions that you have if you're unsure of the decision you're making. I fully get it. And that's why I wanted to create a platform that's more interactive than just trying to do a Facebook Live. Hopefully I don't throw my computer on the floor. But anyway. Okay, guys. Well, I'm going to go ahead and jump off here and get on with some other things I've got to get done today. But I love you all, and any ideas you have, please send it my way. I'm more than happy. I just want to create a situation where it's more interactive, and I can, educate people week by week and then have a way to follow up with them on a consistent basis. So, and also I am open for consultations. If you're interested in a consult, more than happy to help you. All right. Love you guys and talk soon.